All right, now before we talk about these stabilizing and strengthening exercises to get you pain-free, the first things we're going to do is look at the causative factors. Remember the squeezing of the thumb. Now, okay, so if you're watching me now, I want you to take notice because what you want to do is be out, and now you've probably already had this with your therapist, but this might jog your memory even more. So think about what are the movements, the postures, the things that you do that make your back worse, that make it, what are painful triggers? What are painful things that you do? Is it for sitting for too long? Okay, if that is the case, we're going to look at your posture. We're going to look at taking micro breaks, these sorts of things, because if it's painful, you're going to stay in pain. That's all you need to know. We remove the painful triggers and modify them. Okay, so you know, we've all been taught to don't slouch, sit tall. But do we do it all the time? No. So let me explain why bending at the hips and so sitting in good posture, and I want to bust a few myths while we're at it. But let's just, first of all, I need you to think about your spine like a coat hanger. And if I bend that coat hanger, it's going to get weaker and it's going to, well, fine, it will snap, all right, if you continue that. In a similar way, your spine is like that. It needs to be stable in what is known as neutral spine. So I want you to understand this very, very clearly, because when you do, then you can avoid these pitfalls. So, okay, think of your vertebrae stacked one above the other, okay? When they're stacked one above the other, that means you're in good posture, okay? Now think of my two hands are vertebrae. Think if I've got a balloon between my hands. That represents your disc. You've got discs which are like shock absorbers between your spine, between your vertebrae. Now, if I'm sitting up nicely and nice and tall, sitting up tall, then I've got that, what's called the inward lumbar curve. That's what you want. That's why you're better off when you're walking, doing a quick walk, which I'll go into, because your spine is in the spot that it's meant to be. As soon as you go rounding that lumbar curve, rounding it, you've lost the lumbar curve. What happens there? Okay, so think of that balloon sitting here. Now, if I'm sitting up nice and tall, the balloon's equidistant, isn't it? It's sitting in there, no problem, nice shock absorber. But if I bend like this, now the spine does this, and that balloon gets pushed out. You imagine a balloon. If I did that, and squeezing down this side, it's opening up this side, that balloon's going to get squeezed out. That is very similar to what happens with your disc, okay? It gets pushed backwards, causes pain. If it gets pushed back enough, it can then press on a nerve, and you have sciatica, radiating symptoms into your buttock, back of the legs, down to the calf, these sorts of things. So we need to do the opposite movement again, which I'll get into, to push that the opposite way. So the foundation of sitting tall, standing tall, walking tall, okay? So if you were to sit here, put your hands on your lower back muscles, okay? Right at the base there. Now, I want you to just sit forward. Now, you will feel your muscles tighten up. They'll tighten up like this, right? Because to stop you from dropping forwards. Now, if you're not sitting in that position, your muscles are continually contracting. Now, if I ask you to contract your bicep for half an hour, wouldn't last 5 minutes, would you? Because of the contraction. But that's what you're asking of your spinal muscles. So we need to switch those off so they're not working all the time, compressing between the spine. So what do? So you sit tall. Feel like if you're right now, what I want you to do is sit tall and feel like you're just elongated. Don't puff your chest out like this, just getting the feeling of elongated. If you want to get a cushion, a rolled up towel to help the lumbar curve, to help give you support, by all means do. Now, if you're sitting for a long time and it starts to get painful, you got to make sure that you had good posture, and also you want to get up and walk around. A brisk walk, and I'll show you other techniques to help as well, to decompress your spine. But just remember, your posture is absolutely vital, whether you are standing, whether you are walking, whether you are sitting, okay? Now, just to bust a myth here, you don't want to be 90 degrees at the hips all the time. You actually, as long as you're keeping that inward curve, you can be forward at the computer, you can be laid back at the computer, okay? As long as you're keeping the inward curve. So remember that, okay? Keep the inward curve at all times. Now you're healing your back, okay? So stop slouching, stop standing up with your shoulders forward, bring your shoulders back. I always tell my clients, walk like you own the world, Okay, so then you're up like that. Your muscles are not having to do all this work to just keep you upright, so you're in much better shape. So that is really important that you understand that immediately. So sit tall, stand tall, walk tall. Now let's talk about bending techniques. Now remember, you've always been taught to bend at the hips, right? Bend at the hips. But so many people don't. They round out their lower back. Okay, so rounding out that spine when you're bending is once again with the coat hanger. It's got a finite amount of bends before you're going to be in trouble. So remember, if you don't bend like this when you're bending at the, shoveling, whatever you're doing, we're bending forward to pick something up. If you're not keeping neutral spine, you've just done that. Do it a few times, you've just done that and that. So you understand? So keeping that strength, that posture, in all actions that you do, is going to decrease your pain. It's going to desensitize, okay? So avoiding a flexed posture, whether it's bending, whether it's sitting, is absolutely vital for your recovery.